resources patients have to buy their own syringes, needles, cotton wool, and maternity pads. 60% of mothers in sub-Saharan Africa do not have a health worker present during childbirth. That heightens the risk of complications contributing to greater maternal child deaths and disabilities. A pregnant woman is examined in Ethiopia. Progress in reducing maternal and newborn death is insufficient due to factors such as poor health infrastructure, low service delivery, and a lack of qualified health workers. The most basic and natural act of giving life causes the death of almost 10 women every hour. In 2010, 58,000 women died in the region related to pregnancy and delivery, accounting for more than 1/5 of all such deaths in the world. Most maternal deaths are caused by obstetric complications such as hemorrhage, hypertensive disorders, and sepsis, as well as abortions. HIV/AIDS is also a big killer in some countries, particularly in South Africa, where HIV prevalence rates are high. 94% of women deliver their babies without any trained health professional. In Arua, Uganda, Jennifer Angako was slowly bleeding to death right in the maternity ward of a major public hospital. Only a lone midwife was on duty, and no doctor examined her for 12 hours. Half of the 340,000 deaths of women from pregnancy-related causes each year occur in Africa.
Member states of the World Health Organization in the African region stand to lose $45 billion over a 10-year period from 2001 to 2010 if action is not taken to improve maternal health care in the region. Current estimates, if no changes are made to avert maternal deaths, the loss in productivity over the 10-year period will be almost $22 billion, and the loss from disabilities will total $23 billion. At least 2.5 maternal deaths, 7.5 million child deaths, and 49 million in disabilities will be recorded during the 10-year period if the current situation does not change.
Lack of maternal health care has been going on forever, but it really worsened during the scramble for Africa because of the hospitals being built, but the lack of resources, and it also worsened in 2001.
Worldwide, 50% are in sub-Saharan Africa. Of the 536,000 women worldwide who die each year from complications of pregnancy or delivery, 99% are in developing countries. The cause of the problem is the poor state of Africa's health systems. Dr. Luc de Bernis said we know that 15% of pregnant women develop complications that require obstetric care, and up to 5% will require some type of surgery. We have to invest in the infrastructure necessary to do it.
The best possible solution to better maternal health care would be to get about 10 good doctors from each country and transport them all around sub-Saharan Africa. And they'll have the supplies and education to know what to do and how to end this.
I will need 250 doctors in all from the developed countries, syringes, shots, IV bags, blood transfusions, and other medical equipment and medicines. It will need about 5 to 10 years to get it under control. I will need a plane to fly the doctors to a more developed city, and cars to drive them to the underdeveloped ones.
$10 million total in medical equipment will be needed. Each doctor should get paid $100,000 yearly, which in all, for the 5 to 10 years, would be $125,000 to $250,000 totaled over all doctors. $928,250 for the 250 plane tickets to Africa. Total in all, $261,028,250.